Hello, everybody. Great to see you all. I hope you're having a great Thursday morning or Thursday evening, depending on where you are in the world. Really excited to do this. I'm drinking a cup of chai. I just got back from India, and the chai is amazing there. It's made of a milk base that is so fresh and so good with more sugar than I'm used to. So, of course, it tastes yummy. And I brought back some black tea, Darjeeling tea from India. So, I am sipping that this morning. Um, so, wherever you are, get your cup of chai. Maybe it's caffeinated or decaf if it's at night. And let's talk about self-swab for cervical cancer. Okay. So, this is a really important topic, and before I get to the first question, I just wanted to talk a little bit about uh, our topic today, and that is self-swab. So, if you've thought about going to the gynecologist, a lot of times you associate GYN with Pap test. Of course, there's a lot more things we do, but that is one of the biggest things that we do in the United States, which is cervical cancer screening via a Pap test, or you may know it as a Pap smear, for example. Um, and there's many ways of screening for cervical cancer. Now, just so you know, a pap is a screen for cervical cancer. It does not test for ovarian or uterine cancer or any of those things, and it is only for cervical cancer. And over the years, we've developed newer ways of screening for this. So one is the little swab that your doctor does using a speculum. So we put a speculum in, look at the cervix and do a little swab, and that test looks at cells around the cervix. Plus, it also looks at HPV. If you're above 30, we also screen for HPV or human papillomavirus, which is the which is a cause of cervical cancer. Now, another alternative is just to screen for HPV. So we just purely run an HPV test, which is also an acceptable way of screening because, as I just mentioned, cervical cancer is caused by HPV. So this in 2024 in the United States, the FDA has now approved a newer way, which is a self-swab. Now, if you think about going to the gynecologist, many women are freaked out or concerned or anxious or nervous because there is a speculum involved, and that can be a little uncomfortable. It essentially goes into the vaginal canal to open up the cervix or to visualize the cervix, and depending on each individual person, this can be sometimes shameful, sometimes painful, sometimes uncomfortable, and this may cause women not to go to the doctor at all, cause women not to go to the gynecologist, and we definitely don't want that. And so the self swab is amazing because it is essentially a swab. I forgot to bring one from my office in preparation for today, but it's literally a Q-tip. You all have taken a COVID test, right? It's that little Q-tip, and so I give it to the patient. The patient puts it in her vagina, twirls it around, puts it back, and gives it to me, and we send it off. And I don't even need to be in the room when this happens. So it's a really great option for patients who are embarrassed and they don't really want to go through the speculum exam. So when I walk in the room, I just give it to them. I leave. I'm doing other things. When I come back, the HPV screen is done, and so they don't need a speculum exam unless they are particularly concerned about something else. Um, so this is the premise of the self swab. I am so excited to have introduced it into my practice last year, mid 2024, and I've had many patients in my practice do the self swab with great satisfaction. And so let's move on to some questions around this topic. So if you've been putting off cervical cancer screening, could this be an easier, more comfortable alternative? Absolutely. I had a patient who said, I haven't been to the gynecologist in 6 years because I'm just way too scared of this exam. And so I've just been putting it off, and I know I just have to come and do it. And she was so nervous. But I told her about the self swab, and immediately her anxiety, calmed down, and she did this. It was a perfect, option for her. And this is a patient who had a history of trauma. And so she just really didn't like the speculum exam. And so here I was able to offer another alternative. So this is, and you don't have to have a history of trauma for this, but, many people just don't like it. And so this is a easier, more comfortable alternative that you can do at your doctor's office. Let's move on to the next question. Okay, self swab versus traditional pap smear. So the traditional pap test or the pap smear is when we put in the speculum and your physician actually takes some cells from the cervix. Now, if you have always had normal PAPs in the past, you are not sexually active, or you're with the same partner, a monogamous relationship, an HPV screen might just be perfect for you. If you're above 30, this is a great option for self screening, just with the HPV screen. Now, if you've had abnormal PAPs in the recent past, we actually do want to take a look at the cervix and get a sample of those cells to make sure that the HPV hasn't done anything, detrimental to your cervix. So if your HPV screen comes back positive, then you're somebody who will need a PAP test anyway. But if it comes back negative, you're good. And so if you're somebody who always has normal PAPs, no issues, a self swab may be just the perfect option for you. But if you're somebody who's been suffering from abnormal PAPs and you've had to have various procedures, it never comes out normal, there's always something, then until that clears, you may still want to get the traditional PAP. Okay. Any more questions? Let's move on. Who needs cervical cancer screening and how often? Now, we've been talking about this a lot because, I practice in the Bay Area and women are very educated, well read, but still there's a lot of confusion about cervical cancer screening. So, a couple of things I want you guys to remember. Number one, cervical cancer screening, the PAP test only tests for cervical cancer. And I know I've mentioned this before, but it's a point of confusion. Many people think, oh, I get the pap smear, I'm good. I'm good for ovarian, I'm good for uterine, I'm good for all the things down there. But that's not true. It's only for cervical cancer. Anybody above age 21 or anybody who is sexually active needs cervical cancer screening. So in the US, we start at 21. Even if you've been sexually active before, we still start at 21. And we do it every 3 years until about 30. And at 30, we move on to every 5 years and we add that HPV test as well. So that's how we do it here. And we stop at 65 if you've had no other risk factors or if you've had normal tests. So really, it's for anybody who has ever been sexually active or is sexually active. We start at 21. So it's a screening that is very well established in the U.S. and I know is coming up in other parts of the world as well. But really, I do it for pretty much all my patients. Okay. Why is regular screening so important, and what happens if HPV is detected? So, cervical cancers is one of the preventable cancers in our world of medicine. There's just so much we cannot control, right? Breast cancer, colon, pancreatic. I mean, I could go on and on. There's so many, many cancers that we all hear about our friends, our loved ones, our family members getting, and not all of those cancers have any screening. So it's like, what do you do to catch it early? You can't really do much. But there are very few cancers. In fact, there's only 4 cancers that we actually screen for. That's breast, cervical, um, prostate, and colon. Okay, so these are the 4 cancers we actually screen for. And for women, the breast and cervical are the most specific. Um, and so it is a cancer that can be prevented if you actually catch any abnormalities. And so this is why it is so, so important. And this is why I push everyone to get screened because again, in medicine, we can't control everything. We don't have all the cards in our hands. There are a few things we can't control, and this is one of them. So please make sure you get your regular screening. And if HPV is detected, then it depends on your age, depends on the actual PAP result as to whether we just repeat the test in a year or whether we actually do further testing and further procedures, like, for example, a colposcopy. That is a microscope that takes a closer look into the cervix and takes some biopsies. Um, so there are further steps to be done, and then closer monitoring, so to ensure that this doesn't actually progress to cervical cancer. The good thing is cervical cancer is very, very slow growing. So there's lots of opportunities to catch it and to be aggressive and actually prevent it from becoming cancerous. Okay, any other questions? Is self-swab the future of screening? I really hope so. It is, I feel like, as a woman, as a mom, I've gone through labor and delivery and just all of the things we have to go through, right? There's a lot. And it can really take a toll on some people who just don't want another thing to do, and so they just avoid going to the doctor altogether. And so I hate to see that, and I think self-swab could be an answer to that. Certainly for a majority of the population who have, who've had normal screenings and don't really need to subject themselves to a more invasive test. So currently, it is FDA approved in a healthcare setting. So, for example, you can't just do it at home. Right now, you have to be in a healthcare setting. I'm not aware of other practices on the West Coast that offer this at the moment, but my practice in the Bay Area, we've been doing it since last year, and so we've teamed up with a specialty lab to do this for our patients. So if this is something you're interested in, come and see us. And in addition to the self swab, we actually tell you exactly what strain of HPV you have, if in fact, you have HPV. So we are a little bit ahead of the curve, which I'm excited and proud of. But I know this is going to be widespread here in the US, hopefully soon. I know other parts of the world are already doing self swab. I know parts of Africa, Australia are doing self-swab. As I mentioned earlier, I just came back from a trip to India, and while cervical cancer screening is not standard, it is certainly available at many gynecologists' office. So, ask for it. If you want to get screened, which you should, you just ask for the PAP. I'm not sure if self-swab is widespread there yet, but it would be awesome for people to have this option, and maybe in the future, even, swab at home and go drop it off at your doctor's office. That would be great. And I would love to see cervical cancer eradicated in our lifetime. There is no reason why it should not. So we are pushing hard towards that, and this is just one step towards that goal. Okay, so yes, I would love to take any questions if you guys have some. I'm a little nervous. Does the self swab hurt? How deep does it have to go? This is a great question. So the beauty of the self swab is that it does not have to go super deep. You don't need to put it all the way, into the cervix or anything like that. Human papilloma virus, if it's present in the cervix, is going to shed into the vaginal walls. So on the swab, there's actually a line that tells you how deep to go. So it's very much like a COVID swab. If you guys remember the early days of COVID swab, there's this long thing that you just like put all the way into your nose, and it was really painful. This is not like that. It does tell you exactly where to go, and you just kind of twirl it around for 20 seconds. It is not painful. It's not painful at all. You do it, and it takes 20 seconds. Okay. What other questions? What if I have my period? Can I still do the test? That's a really good one. I probably would not do the test if you have your period. There is an internal control on the test. So when the test goes to the lab, and if they feel like, there's just not enough cells to give you an accurate answer, the test will come back just, saying that it's not valid and you have to repeat it. So in my opinion, like, why go twice to do the test? If you have your period, I would just, postpone the test to another time. I'm over 50. Should I still be getting screened for cervical cancer, or is it only for younger women? Great question. You should still be getting screened for cervical cancer. In the United States, we stop at 65 if your past 3 screenings have been negative. Now, HPV is tricky because you can have negative HPV, and then years later, you can suddenly have a positive test because it resurfaces from your body due to stress or, poor health or whatever. So just because you're negative this year doesn't mean, oh, you're always going to be negative. So that's why we stop at 65, provided you've had 3 negative screenings in the past. But you should be getting screened until 65. And in my office, for patients who have new risk factors, like they have a new partner, they're married to somebody else now, or they have multiple partners or whatever, I still continue screening even after 65. And there are many patients who want that. So yes, uh, cervical cancer can, strike anybody, hit anybody. So this is not age dependent. So please keep getting screened. Anything else? Where do I get one of the self-swab kits? Can I buy it online, or do you need a prescription? Okay, so you cannot just buy it online right now. This is only done at your doctor's office. So I would ask your gynecologist next time, hey, do you guys offer a self-swab for HPV? And like I said, in my experience, I'm in the San Francisco Bay Area. I don't know of any other offices offering this in my neighborhood right now, but it is FDA approved and should be getting rolled out all across the US. But certainly you should ask your GYN's office. And currently it's FDA approved only in a healthcare setting, so you can't do it at home yet. Any other questions? What happens if my test comes back positive for HPV? Does that mean I have cancer? Not necessarily. HPV is super common. 60 to 70% of American women have HPV. There's many different strains of HPV. And only a few cause cancer. Please go back and watch some of my previous episodes on Thursdays. I cover this in detail. I also have several episodes on this topic on my YouTube channel. So, we'll link some of those below. But I have a lot more detail about this topic. But it does not mean you have cancer, but it does mean that you need to be monitored a little more closely. So instead of saying like, oh, just come back in 3 years for your PAP, we're going to do it next year. Okay. How do I know if I did it correctly? What if I mess it up? Okay. So it's there is a mark as to how deep you need to go. And once you twirl it for 20 seconds, you're done. Um, as I mentioned previously, there's like a control in the test. So when it goes to the lab, they actually check to see if it's a valid sample. Are there enough cells? Does it meet that criteria? And if it doesn't, they'll just, say it's not valid. So you don't need to worry about whether you did it right or not. The lab will tell us. And out of all the patients that I've done so far, everyone's gotten it right. So I think it's pretty easy. Okay. I've heard about self-swabbing for cervical cancer, but it really is good as a PAP. Well, the self-swab is a little bit different because it's only a screen for HPV, which is a valid way of screening for cervical cancer. If you don't have HPV, you're not going to get cervical cancer. So yes, it is totally a valid test. Now, if that comes back positive, then you need to go a little bit further and you actually need to do the PAP to see if the HPV has done any damage to the actual cells of the cervix. But it's a legit, valid way of screening for cervical cancer. I love these questions. These are so great. Thank you all so much. Is self-swabbing covered by insurance? Yeah, it's covered by insurance. It's just cervical cancer screening. So my patients have had no problem. Their PAPs have been covered by insurance, as has the self-swab. So you don't have to pay out of pocket, which is great. Um, can I use a self swab? Yes, you can use a self swab if you're pregnant. We do PAPs and HPV screening on pregnant patients, so no problem. You can use it. Okay. If I get an abnormal result, does that mean I need a biopsy right away? Not necessarily. It depends on a few different factors. It depends on your previous history of PAPs and HPV. So we need to kind of put it all together and see whether you need a biopsy or we just wait a year and repeat the test. This is clearly a hot topic because I've got so many great questions. I want to thank you guys. Yay, My Eve Wellness. Thank you. My Eve Wellness is a ultrasound facility in San Francisco that offers 3D ultrasounds, breast ultrasounds for patients. So if you have dense breasts or are worried and you can't get into your doctor, just go over to them and they'll take good care of you. I have a whole reel about them on my YouTube channel, so check it out as well. Great. what if I have symptoms like spotting or pelvic pain? Should I do a self swab or go straight to my doctor? Okay, so if you have spotting or pelvic pain, that may signify other concerns. So you should definitely see your doctor. You should definitely get a good exam, a pelvic exam, and a full workup. So remember, a self swab is only screening for cervical cancer. It's not going to tell you anything else about your uterus or ovaries or anything else that's going on. Okay. Well, if you guys have more questions, please keep posting them. I'll do a little video to answer those throughout the week. Thank you so much for showing up with to Chai with Cheruba. This was a great session. I have so much fun doing it, and I hope you guys are learning something. Please share this with a friend or a family member, a relative who may find this useful as well. And we will see you next Thursday at the same time for Chai with Cheruba. Don't forget to follow us at the Fibroid Doc on YouTube and Instagram, as well as TikTok. And if you're in the Bay Area, come and visit us. I have a private practice in the Bay Area, and would love to see you. We offer really personalized, cutting edge medicine. As I said, we were one of the first to roll out the self swab last year, and so I'm passionate about taking great care of women. And so come see us. All right, guys, until next time. Bye.